afternoon. Okay, good afternoon, and thank you very much to all of you for coming to this tobacco control seminar. In this occasion, we come with Dr. Filippos Filippidis. Thank you very much, Filippos, for coming and to being here. As you may see, we are almost in family. There are people from the unit and other people from other units and other institutions. And I'm very happy to have all of you here. So, thank you very much for coming. I don't want to speak very much, just to introduce you, in addition to express my gratitude. But a few words about Filippos. As you may see also, we are almost in family, I was saying, and I believe that the environment will be friendly. So, usually what we do is that we make your speech, and at the end we will have some comments, dialogue, questions, and so on. In case perhaps that someone can stop the question, in some cases some people raise their hand. Have to be interrupted if you don't agree, or I believe. But perhaps it would be better to have all the questions at the end of the talk. So, Filippos, Dr. Filippidis, is lecturer in public health in Imperial College London. In fact, he's not British, as his name and family name reveals, and you are aware. He is from Greece, from Athens, I think so. And he studied medicine in Athens. And he did his doctorate in Athens and also in a postdoc stay and a master of public health stay, a master of public health training in Harvard, in the United States. And when coming back from the United States, he finally went to London, where he's teaching epidemiological methods at the master's degree in public health and perhaps other. So, and why he is here? Because he has been very active in research. He's a researcher on tobacco control. He has published more than 60 papers, not only in tobacco control, because you have been involved. He, with other Greek colleagues, have done very good job relating some health conditions to the economic crisis in Athens, changes in mortality, in lifestyles, and even he, from time to time, writes papers regarding the Eurovision contest and infection and suicide. But this is anecdotal. But I believe that this, I wanted to explain this because this, I believe that this also is useful to characterize Filippos. He's a very open person. In fact, we know each other from, we didn't know, 8 or 10 years. Yes, because he was involved in the health promoting hospitals network in Greece. And we knew each other with Christina in some congresses. And I believe that he has been very active in applying epidemiological methods, and he has focused finally mostly in tobacco control. So for us, it's, as I have said, a pleasure to have you here, because he was in Barcelona for other meetings, and before going to Madrid to other meetings at a congress that starts on Wednesday, he offers his time to us coming to ICO to share his knowledge using one of the tools that some tobacco control researchers have been using in the last years, that is the Eurobarometer. So he will focus on how he has used, which are the uses that he and others have given to the Eurobarometer survey, which includes from time to time, as you will explain, some questions on tobacco control, and perhaps we may discuss about its usefulness, future things that can be done, what does the Eurobarometer has and what it hasn't, and so on. So, thank you very much again. We will try to be very active as well, and I believe that sharing all this will be a very good thing for all of us. Thank you.
Thank you very much. It's a real pleasure to be here. I know people usually say that, but I have some people who I consider friends or worked with before, so I'm happy to see you. You know who you are. And also Barcelona is a kind of special place for me. I was lucky enough to be here about 12 years ago as a medical student doing an exchange program. I had a lot of fun. I spent half of my time, my day, right next to here, Filippidis Hospital. So I don't even remember the names of these people, but they were really nice people, and you know, it was very interesting for me. And the rest of my time, oops, wait, not there. Oh, there was another photo. That's a shame. Let me see if I can. Like that. So fresco. I have very fond memories of this place. I don't know why it does not appear. Maybe everyone wants to protect me from this terrible part. But you know, as students, we wouldn't eat all day, and then we would go there. It was all you can eat. So I have very fond memories of this place. Does it still exist?
Yes.
Right. So as Steph said, most of my work is on tobacco control. I do other things for fun or not, but most of my work is on tobacco control. And it so happened that I started working on the Eurobarometer data sets, about which I will talk about today. And then it turned out to be a very rich source of data that we could use in different ways. And we've written some papers with people here and with other groups in Europe and beyond. And I think we've contributed to Eurobarometer being appearing more often than before in tobacco research. So since it's a family gathering, you will all be familiar with the FCTC, the Framework Convention on Tobacco Control. Just wanted to give the background. So the European Union has signed the FCTC as an entity, so it is legally binding for the European Union to follow what is in there. Yeah, I tried, but anyway. And part of following the FCTC, WHO developed the Empower package. Pretty sure you're familiar with it, but I will build my presentation around the Empower package. So you can do different things with Eurobarometer, and I wanted to show that Eurobarometer can be useful for each of these elements of Empower. And then in 2014 we had the EU Tobacco Products Directive that has shaped tobacco control in Europe for the years to come. And by 2016 basically all European countries had transposed it to their national legislation. So one of the uses of Eurobarometer is to see what happened before and after the EU Tobacco Products Directive, which I will refer to as TPD. Okay, so let's, I guess many of you don't know much about Eurobarometer surveys. These surveys are run by the European Commission, and they run in each member state, 28 for now. The UK will will leave, so it will be back to 27. And in previous years they also had some ascending countries participating, so you had maybe Serbia or Ukraine, I think, or Turkey occasionally, but now that money is tight, they only focus on the 28 member states. So this runs a few times every year, 4 or 5, I'm not sure, and every time they have slightly different topics, and it is being used to monitor Europeans' opinions on different topics. So it could be politics, it could be the role of the EU, it could be use of robots, it could be environment, and you also have some health-related topics such as tobacco, and you also have physical activity occasionally, diet, antimicrobial resistance, and use of antibiotics, and so on. And the idea is that you have about 1,000 people from each country participating and giving interviews. So in total, around 28,000 people. Of course, smaller countries contribute slightly smaller samples, like Malta, which they have about 500. And the samples are representative at the country and EU level. And the EU is classified in different areas. So there's something called NATS classification. And NATS 0 is the member state, the country. And then you have NATS 1, which are major socioeconomic regions. I have the examples from Spain here that you might be more familiar with. So Spain would have 7 NATS 1 regions. Then you have NATS 2, which is a smaller region within the bigger regions. Spain has about 19, not exactly 19. And then you have NATS 3 regions, which are small regions. Spain will have 59 of those. What Eurobarometer does is that they get samples that are proportional to the population size of the region. And for all the countries, with the exception of the UK and Germany, which have bigger populations, you would have samples that are representative at the NATS 2 level. But for the UK and Germany, you only have for NATS 1 level. So you can look into more detail, not only by country, but even within regions in countries. And as I said, you have about 1,000 respondents in each member state, individuals aged 15 years old, 15 years or older, which means it doesn't include children, but not exactly adults, with the definition of 18 years old. But for smoking, for example, this is great because many of the international surveys focus on 15 years and above. This is the standard. The interviews are face-to-face in the local language, so the questionnaires are developed in English and French, and then they're translated to all the other countries. There is a company that is responsible for that, and then they have local representatives in every country. And after they collect the data sets become publicly available online. So you can go after a few months when they clean them, and they prepare them, and you can download them, you can search. You have to say why you're using them, but then nobody's really taking it. But you are allowed to use it for research, and it is available for free. And as I said, there's a variety of themes that are assessed in Eurobarometer surveys, including socio-demographic data. So you would have people's age, education, difficulty paying bills, political opinions, area of residence, education, if I haven't said that, and so on. And they do publish descriptive reports. European Commission, whenever they run a Eurobarometer survey, then they will have a report published online, but it is quite descriptive, so they don't run any migration analysis, or they don't look into subgroups that much. They are more detailed now than they were before, so you get the descriptive bits on how many people smoke in every country. You will get that, how many men, how many women, but they don't adjust for anything. They don't follow complicated statistical methods, which is good, because otherwise, what would we do if they did it? So I hope they don't get more advanced on that. So you will find. Right, so these are among all the Eurobarometer surveys that have been done. I don't remember when it started, but it's back in the, I would say, 19th century, but it's not 19th century, it's the 1990s. And we have special Eurobarometers on tobacco since 2005. So 2005 and 2006 are grey here because the questions are quite basic and not necessarily similarly worded as in subsequent survey. So the question on whether you're a smoker or not is not exactly the same. So it might be a challenge to compare all the data sets with more recent ones. It could be done, but there are limitations, and that's why I have it in a different color. So we had one in 2009, 2012, 2014, and the most recent one in 2017. And you see the sample size is about the same every time, it's about 1,000 people. I don't have a watch, but I'm monitor time. I'm not checking my messages. Although I just saw the tweet from Stella. Right, so what we do in terms of analysis is we use the socio-demographic variables that are available, and then the tobacco-related variables. And one important thing to say is that there are weights in this data set, which means that there's a variable which we have to use in order to make samples representative. And this has two elements. One is that we want it to be representative at the country level. So 1,000 people in Spain, but you might have oversampled women, for example. So we use weights to make it closer to the actual distribution of the population. But also Spain is obviously much bigger than Estonia or Greece in terms of population. So if you have 1,000 people in Spain and 1,000 people in Greece, you have to use weights if you want to have an overall estimate of the prevalence of smoking, for example, so that Spain contributes 4 times as much as France. So this is important to take into account. And observations are clustered within regions and within countries, which means people are more likely to give similar answers to each other if they are from the same region. So this is something that you have to take into account when, or in the same country. So this is something to take into account when you do your analysis, and this can be done either with multi-level modeling, which is the method I prefer. So this allows for clustering of the observations. Probably not interested in that much detail in the methodology, but you can also adjust for the country of the respondent. That's another way to do it. So you basically say you would compare people in Spain with themselves and not with the others. But also because you have 28 countries or 200 regions, if you're looking at the NUTS 2 level, NUTS 1 and NUTS 2 level, you can also do ecological analysis, which means you will take the country or the region as the unit of analysis, and then use other kind of data like income at the country level, or percentage of people with tertiary education, or prevalence of smoking, and then do an analysis at the country or at the regional level. So now I will show you some of the things that we've done with Eurobarometer studies, with Eurobarometer datasets, and I will follow the Empower topics. So first one is monitor tobacco use and prevention policies, and basically this is why Eurobarometer was designed for. They wanted to monitor what's happening over time in different countries. This is what the European Commission is interested in. They do policy, they're not that much interested in research, that aspect, but they wanted to have the survey in order to be able to follow what's happening. So this is a paper that was led by Ariadna from the department here, and you can see smoking prevalence in 2014 and the change in smoking prevalence between 2006 and 2014. So looking at a number of Eurobarometer data sets over time, you can see that smoking prevalence increased in some countries, but decreased in most countries, and mostly in Northern European countries you have the biggest decline during this period of 8 years. So this is important, especially for policies, even if you don't make associations with anything, which Ariadna did. It is important to know that these countries are doing well, these countries are doing well. Another thing that we explored was the mean age of regular smoking initiation among early smokers. So we only looked at people who were smoking at the time of the survey or who were former smokers, and we, people at Eurobarometer, asked them at which age they started smoking regularly. And then we only took people younger than 40 years old so that we can take a relatively recent period of time. Somebody who is 70 might have started smoking 60 years ago, but it was very, very different. And we compared the countries, and it is interesting. One of the interesting things of Eurobarometer is that you can compare countries between them, and even though it's Europe and some of the policies are kind of similar, and we say we share the European culture and so on, things can be very different between countries. And that's also interesting because then you can try to identify what is the driving force between these differences. So you can see Spain is here, people start smoking regularly when they're 16.6 years old. And this is exactly the European, the EU average. But you can see many different starting ages. So in Slovenia you have 18.8, so most people start smoking after they're 18. And you have a number of countries where people start smoking when they are 16 or younger. So this can have a lot of implications in terms of the policies you will follow. If people start either at school or never, then you would focus in this younger group. If they start later on, then you would be concerned about what's happening after they become adults. Usually you know better when you are adult, and you wouldn't start smoking, but if you're in an environment where everybody's smoking, I can speak of my home country, Greece, where people go to the military, men have to go to the military when they become adults. And then traditionally, the gift you would give to somebody who is doing the military service is a pack of cigarettes. Not that much anymore, but when I was growing up, people would think they do a good thing when they give a pack of cigarettes to random soldiers, around the country. So this might be responsible for the slightly later older age that people start smoking in Greece. And then we did a regression analysis within the same study, and we found that people who start smoking because they were asked, why did you start smoking? Because your friends were smoking, because your parents were smoking, and because you thought cigarettes are attractive. So people who said that they were influenced by their parents and by their friends, they were much more likely to have started before the age of 18. So younger people are mostly influenced by friends and parents, and not that much by how attractive cigarettes look. It's about fitting in and following the example. For some reason, my pictures do not show. What? Okay. That's alright. I have plenty of. I should have done it PDF, but that's right. I have plenty of slides, so and so you can also look at other things that we don't usually think about. Because Eurobarometer covers a lot of topics, then you can make associations between smoking and other things. And we thought, let's look at political views and if these are important. We found that, so this is not a regression model, but the differences remain when you run a regression and you adjust for different factors. So people that position themselves in the far left in terms of political views are more likely to smoke compared to those at the center. And I think people at the center right were less likely to smoke than people in the center. Of course, again, this has the caveat that what is center left might be different in Spain compared to Greece and compared to Sweden. Okay, but it might be something to take into account when you consider public policies. This is the regression model, and you see that people in the center right are less likely to be smokers, people in the far left are more likely. It has to do with potentially how you see life and the people you hang out with, and then we'll look at policies as well. Yes, of course.
Did you take into account the age of the
Yes, so this is so this is adjusted for age, sex, education, income, area of residence. So major socio-demographic factors that would influence them. It's not that far left are younger, and that's why. And then it's the e-cigarette issue, which is a very heated debate and great interest for the tobacco community. And this is comparing ever use of e-cigarettes in 2012 and in 2014. And you see again major differences between countries, and some countries were early adopters, but then they didn't continue with that increase. Some others, like France, where more than 20 people had ever tried e-cigarettes in 2014, and that's even higher now. And Spain is, again, somewhere in the middle. And then we looked at how many of those people have ever used e-cigarettes transitioned to current use. So they were asked, are you currently using e-cigarettes? Yes, no. And have you ever used e-cigarettes? So many people, as we know, experiment with cigarettes, but they never become actual users. They just try from a friend, etc. And then again, you see very different percentages in different countries. You have the United Kingdom, for example, where policies are quite friendly to e-cigarettes. So e-cigarettes can be not prescribed, but if you go to a smoking cessation clinic, the doctor or health professional will tell you, oh, you could try an e-cigarette to stop smoking. It's not the case in many other countries. So in the United Kingdom, about 1/4 of the people who have ever tried e-cigarettes end up using e-cigarettes kind of regularly. But this can be very different. So in Slovenia, almost no one becomes current user. So again, this might give us an insight into how things work within the market and policies and smoking cessation. And also we can monitor other products like Pipe, and we looked at all the available data for 2009, and I think what's interesting here is the age differences. So there was an increase after 2014, and then there was a slight decrease in all the age groups. I think that might have to do with the rise of e-cigarettes, but I cannot prove that. That could be an interpretation, or could be that it was something very popular because it was in fashion, and then it slowly becomes out of fashion again. But you can see people 15 to 24 years old, this is the line above, were much more likely to have ever used water bike compared to people 15 years old or older. And this is ever use. Because a few decades ago, water bike was very rare. Now you see shisha, cafes everywhere. I don't know, how would you call it in Spain? Shisha or shisha?
Shisha. Cachimba.
Yes, and this is prevalence of every use of water by tobacco. I think Spain is relatively low. Yeah, well, it is increasing though, yes. So it is really useful, Eurobarometer is really useful to monitor changes over time. Then you have protect people from tobacco smoke, so this is exposure to secondhand smoke. And there are 3 questions usually in Eurobarometer in red. Have you been exposed in the past year or 6 months, I don't remember. In restaurants, cafes, and the workplace. And you see a comparison between 2009 and 2014. What is interesting here is that you see some percentages changing really radically. For example, Spain, and you don't know why this happened between 2009 and 2014. Of course, then you have Greece, where the similar law was introduced, so after 2009, but nobody cared, so people kept smoking in restaurants. And this is bars, which is quite similar but not as good, and this is workplaces. So this is also helpful to monitor and see if the legislation is working, and also compare different restaurants with cafes, for example, where it's less likely for this to be enforced. Also help to quit tobacco use, so smoking cessation is an important issue. A few years back we looked at use of cessation aids in order to stop smoking. So more people who are trying to quit in the UK, Ireland, in Scandinavia are using cessation aids compared to some of the other countries. And then on the right you have recommended cessation aids, so that would be NRT and getting advice from a health professional. Again, we looked and saw that countries where this is covered by, the cost is covered by the government or any other institution, it is more likely to use a cessation aid in order to quit smoking. And this is how things changed between 2012 and 2017. And you see that people who are using assistance to quit smoking are decreasing between 2012 and 2017, and there's a huge increase in the use of e-cigarettes. So almost three times as many people have used e-cigarettes in order to quit compared to 2012. Too many numbers here, but I think that this one could be better. Can you read the countries? Probably not. But this shows, so this pharmacotherapy cessation services for e-cigarettes between 2012 and 2017. The vertical line means no difference. So if it is on the left-hand side, it means that it was less likely, so this is a regression model, it was less likely in 2017 to use one of these services compared to 2012. If it's on the right-hand side, then it was more likely in 2017 compared to 2012. You see that pharmacotherapy is declining in most countries, in many countries at least. Cessation services, similarly, e-cigarettes increasing in almost all European countries. Spain is here, so pharmacotherapy decreasing statistically significantly, cessation services decreasing but not significantly, and e-cigarette use increasing. So following pretty much the same trend as in other countries. And the United Kingdom, that is very open to the use of e-cigarettes, you see it's 6 times more likely to use e-cigarettes to quit smoking in 2017 compared to 12. And who are these people who are using e-cigarettes to quit? I think these numbers here are the most important. People aged 15 to 24 and then 25 to 39 are much more likely to use e-cigarettes to quit smoking compared to people of older age. And this again from Ariadna's paper, these are the quit ratios, which means the proportion of former smokers to ever smokers, right? Yes. And you see obviously in countries that are ahead of the others in terms of the tobacco epidemic, like in Scandinavia, there are many more people who have quit smoking. What about the dangers of tobacco? So one of the questions is whether you support plain packaging, which is not included in the tobacco products directive, but many countries have started implementing it. And you see if you're a smoker, you're much less likely to support pictorial warnings and plain packaging. If your country already has pictorial warnings, you're much more likely to support plain packaging as well. So you've been used to seeing pictures, so you're more likely to support plain packaging. Bans on tobacco advertising. So many people, even though advertising is pretty much banned in most European countries. I was in Germany recently and it's pretty terrible. You can still see posters with cigarettes, how amazing they are. But about 1/3 of the people have seen tobacco advertisement over the past year, which is about some kind of promotion, that is. And what is interesting is for e-cigarette advertising, online sources are really important. So people who use the internet a lot, they see they're more exposed to e-cigarette advertising. Whether this is a good thing or bad thing, so in the UK you would say, oh, this is a great thing because then you help them quit smoking. Probably in most of the other countries you would say, oh, do we want e-cigarette advertisements to be on? Probably not. So this is the main source of exposure to advertising. And you see for e-cigarettes on the right-hand side, it's sales points is the main thing, but also online is a major source of exposure to advertising. And yes, this shows that people who use internet often are more likely to be exposed to these advertisements. And finally, raise taxes on tobacco. So this is from a slightly older study where we looked at changes in the country's GDP and changes in support for increasing taxes. And we saw that if the country was not doing well in terms of GDP, economically, it had economic problems, financial issues, then it was people were less likely to support raising taxes, which is something that you would expect. And this is support for different policies. Again, this is political views, and you see that people in the center-right are less likely to support tobacco control policies compared to people at the center. And I think this is the main finding for this application. Right, so these are things that we've done. I have to say Eurobarometer has become more popular in research in recent years. I've searched PubMed, and these are the number of publications by year with the keyword Eurobarometer. Obviously, it's not only used for tobacco, many other disciplines, or even for medicine. There are many other disciplines that are using Eurobarometer data, political science, social science. I did not include these. But it is becoming more established and more popular. And you have about 30 papers a year now with Eurobarometer. Oops, again. So, pros and cons. Pros is that it has 28 European countries, so you can compare countries with each other. Big sample, representative sample, you can compare between countries because they use similar questions. There are multiple ways, so you can follow them up for a number of years. The data sets are clean and available, so if you have students who want to do summer project or dissertation project, this is a great resource because the data set is there and they can use it straight away without much effort. Because we have too many students for the project we have available, whenever I have to figure out the project, I see what's the latest Eurobarometer, is there anything around health, can we develop a project with this, and it usually works. And it covers a wide range of topics, and you have data at sub-national level, so you can run ecological studies using the region, which is quite powerful. But questions change over time, so they're not necessarily consistent throughout the years. At some point they will decide they will change the question, and of course you have no saying because the data set is there, so even though you had in mind to compare something, you cannot guess.
Who are they?
Who are they?
Yeah. And do they have an advisory board or someone who assists them including like new questions or?
So they do, this is a company, this is the European Commission, I think, advertises that they want somebody to run the process. I think it's Cantar Public is the name of the company. And they're very nice people, and they do consult, I've met a couple of them, they do consult experts when to include a new question, etc. But, and I'm not saying that they change questions randomly, but at some point they will decide to change, and you wouldn't know until the survey is out, the data set is out, so you have no control of it. As with any publicly available data set, but sometimes it happens. The question is not necessarily consistent with major tobacco surveys, for example, CATS. It could be, for example, many tobacco surveys, they ask, have you, how many of the past 30 days have you smoked? One, and if you smoke one or more, then you usually consider the smoker. For Eurobarometer, it's just how would you consider yourself? Current smoker, former smoker, never smoker. So it's not necessarily comparable with other studies that are quite standard. Data is self-reported, like in most surveys, but you might find inconsistencies. Are you a smoker? No. How many cigarettes do you smoke? 10, right? But that happens in every self-reported survey. It's not the problem of Eurobarometer itself. The samples are relatively small by country, so if you want to look at subgroups, 8 subgroups, etc., within a country, then you don't have so many people. Many national surveys, they would have 5, 10, 20,000 people. Here you only have 1,000 people, so if you want to focus on one country, it doesn't really work very well. It's not designed for research. The purpose is for the European Commission to follow what's happening in the European Union, so not necessarily. If you design a survey, you would have all the variables you want, the way you want them. This is just secondary data, so you have your limitations. They don't publish response rates, which is an issue. In theory, they control for low response rates by including weights, so then you would, if you oversample women or young people, then you would just start with weights. But whenever you want to publish in a really good journal, they might reject it on the basis of not reporting response rates, which has happened to somebody else. And it only has EU countries, so if you want to look at a slightly bigger group of countries, European countries, there's no way you can include other countries. So I think, yes, that's it.